Question 1. As a registered behavior technician, RBT, who is primarily responsible for designing and overseeing the behavior intervention plan for a client? A. The RBT themselves. B. The client's parent or guardian. C. A board-certified behavior analyst, BACB, or board-certified assistant behavior analyst, BACB. D. The client's teacher or therapist in another field. Answer: C. A board-certified behavior analyst, BACB, or board-certified assistant behavior analyst, BACB. This question is about the RBT's place on the clinical team and their role in relation to their supervisor. The keyword primarily responsible for designing and overseeing points to the expert role. RBTs work directly with clients, but they implement plans created by certified professionals with more advanced training, the BCBA or BCABA. These supervisors are responsible for developing the overall strategy, making clinical decisions, and ensuring the plan is appropriate and effective. Parents, RBTs, and other professionals are important team members, but the BCBA/BCABA holds the main responsibility for the behavior plan. Think of it like a construction project. The architect, BCABA/BCABA, designs the building, and the construction workers, RBTs, build it following the blueprints. Question 2. In the ABC components of behavior analysis, what does the C stand for? A. Cause. B. Control. C. Consequence. D. Command. Answer: C. Consequence. This question asks you to identify the third part of the fundamental ABC model, which helps us understand behavior. The ABC stands for antecedent, behavior, consequence. The antecedent is what happens right before the behavior. The behavior is what the person does or says. The consequence is what happens immediately after the behavior. The consequence is important because it influences whether the behavior is likely to happen again in the future. Understanding the consequence helps us figure out why the behavior is happening. For example, if a child says, "Water, please," behavior, after seeing an empty cup. Antecedent, and gets water. Consequence, the water is the consequence. Question 3. If a behavior occurs more often in the future because a desirable item or activity was presented immediately after the behavior, this is an example of A. Negative reinforcement. B. Positive reinforcement. C. Positive punishment. D. Negative punishment. Answer: B. Positive reinforcement. This question asks you to identify a core principle of behavior change. The key phrases are occurs more often in the future, meaning the behavior increased, and desirable item or activity was presented immediately after, meaning something good was added. When you add something pleasant after a behavior, and that behavior increases, it's positive reinforcement. Positive means you added something, and reinforcement means the behavior got stronger or happens more often. Negative reinforcement involves removing something unpleasant to increase behavior. Punishment decreases behavior. If a child cleans their room, behavior, and you give them allowance, desirable item presented after, and they clean their room more often, that's positive reinforcement. Question 4. If a behavior occurs less often in the future because a desirable item or activity was removed immediately after the behavior, this is an example of A. Negative reinforcement. B. Positive reinforcement. C. Positive punishment. D. Negative punishment. Answer: D. Negative punishment. This question is similar to the last, but focuses on decreasing behavior by removing something good. The clues are occurs less often in the future, behavior decreased, and desirable item or activity was removed immediately after, something good was taken away. When you take away something pleasant after a behavior, and that behavior decreases, it's negative punishment. Negative means you remove something, and punishment means the behavior got weaker or happens less often. If a teenager stays out past curfew, behavior, and you take away their phone for a day, desirable item removed after, and they stay out late less often. That's negative punishment. Question 5. When teaching a new skill, providing a little extra help to the client before they respond is called A. Fading. B. Prompting. C. Reinforcing. D. Extinguishing. Answer B. Prompting. This question asks about the term for giving help during the learning process. The phrase providing a little extra help before they respond defines a prompt. Prompts are cues or assistants used to guide the learner to the correct response so they can receive reinforcement and learn the skill. Fading is gradually removing prompts. Reinforcing happens after the correct behavior. Extinguishing is stopping reinforcement to decrease a behavior. Prompts are like hints that make it easier for the learner to get it right. Question 6. What is the main reason we collect data on a client's behavior? A. To prove to parents that progress is being made. B. To make the therapy sessions look more professional. C. To make informed decisions about the client's plan and track progress objectively. D. To keep the RBT busy during the session. Answer C. To make informed decisions about the client's plan and track progress objectively. This question is about the crucial importance of data in ABA. Data is the foundation of our practice. It tells us if the interventions are working, if a skill is being learned, or if a challenging behavior is decreasing. Collecting data helps the supervisor make objective, informed decisions about whether to continue, change, or stop a program. It's not just about appearances or busy work. It's about using objective information to guide treatment and ensure the client is making progress. Data gives us a clear picture of what's happening with the behavior. Question 7. If you want to measure how many times a client claps their hands during a 10-minute period, which data collection method would you use? A. Duration. B. Latency. C. Frequency. D. Whole interval recording. Answer C. Frequency. This question asks about measuring the simple count of a behavior. The phrase "how many times" is the key. Frequency recording is simply counting each instance of the behavior. Duration measures how long it lasts. Latency measures the time until it starts after a cue, and whole interval recording measures if the behavior happens throughout an entire interval. If you just want to know how many times something happened, use frequency. Just put a tally mark each time you see it. Question 8. You are teaching a client to put on their socks. You break the skill down into small steps. 1. Pick up socks. 2. Put opening over toes. 3. Pull sock over heel, etc. This list of steps is called A. Behavior chain. B. Task analysis. C. Skill acquisition program. D. Behavioral objective. Answer B. Task analysis. This question asks about the process of breaking down complex skills. The phrase "break the skill down into small steps" describes creating a task analysis. TAE. A TAE is a list of the individual steps required to complete a complex task from start to finish. Once you have the TA, you can use different chaining methods, like forward, backward, or total task, to teach the steps. A behavior chain is the sequence of responses performed after the TA is learned. A skill acquisition program is the overall plan, and a behavioral objective is the goal behavior itself. The breakdown of steps is the task analysis. Question 9. When determining the potential function of a behavior, if the behavior occurs when the client wants a specific toy or food item, the function is likely. A. Attention. B. Access to tangibles/activities. C. Escape. D. Automatic reinforcement. Answer B. Access to tangibles/activities. This question asks you to identify one of the 4 main functions of behavior. The clue here is that the behavior happens when the client wants a specific toy or food item. If the consequence of the behavior is getting a desired item or activity, the function is likely access to tangibles/activities. Attention is getting noticed. Escape is getting away from something unpleasant. Automatic reinforcement feels good internally. If the behavior leads to getting a preferred item, it's likely access. Question 10. If a client engages in a behavior, like flapping their hands, because it feels good to them internally, without any external consequence, like getting attention or a toy, the function is likely. A. Attention. B. Access to tangibles/activities. C. Escape. D. Automatic reinforcement. Answer D. Automatic reinforcement. This question describes a function where the reinforcement for the behavior comes from the behavior itself, based on how it feels internally. The phrase feels good to them internally, without any external consequence, points to automatic reinforcement. This happens when the sensory experience of performing the behavior is reinforcing. E. K. Rocking, humming, hand flapping. It's not maintained by getting something external from others. Automatic means the reinforcement is built into the behavior or its immediate sensory feedback. The behavior is rewarding in and of itself. Question 11. You are teaching a client to point to a red car when you say, touch red car. You have both a red car and a blue car in front of them. What is the red car in this scenario? A. The est, discriminative stimulus. B. The MO, motivating operation. C. The stelta, S. D. The consequence. Answer A. The est, discriminative stimulus. This question asks you to identify the specific stimulus that signals the correct response will be reinforced in a teaching trial involving discrimination. When you have multiple items present, the one that matches the instruction and signals that a response to it will be reinforced is the discriminative stimulus, STI. The blue car, which does not signal reinforcement when touch red car is said, is the stelta, S. The instruction touch red car is also part of the est or the complex ested. The MO affects motivation, and the consequence happens after the behavior. The red car is the target stimulus you want them to respond to in the presence of the instruction. Question 12. If a client performs a skill correctly after a period where that skill was not being specifically taught or reinforced, this demonstrates A. Generalization. B. Discrimination. C. Maintenance. D. Extinction. Answer C. Maintenance. This question asks about the ability of a learned skill to persist over time. The key phrase is performs a skill correctly after a period where that skill was not being specifically taught or reinforced. Once a skill is learned, we want it to last. This continued performance over time is called maintenance. Generalization is performing the skill in new situations. Discrimination is telling things apart. Extinction is decreasing a behavior. Maintenance shows that the learning has stuck, and the client can still do the skill even without constant practice or reinforcement. Question 13. When working with a client, you should always maintain professional boundaries. Which of the following is an example of maintaining appropriate boundaries? A. Accepting a small monetary gift from the client's family. B. Becoming friends with the client's parents on social media. C. Limiting discussions with the client's family to topics related to the client's treatment plan and progress. D. Agreeing to meet the client and family for dinner outside of sessions. Answer C. Limiting discussions with the client's family to topics related to the client's treatment plan and progress. This question addresses the importance of professional boundaries. Maintaining professional boundaries means keeping your relationship with clients and their families strictly professional, focused on the client's therapeutic needs. Accepting gifts, becoming friends on social media, or socializing outside of therapy are all examples of crossing professional boundaries, which can compromise objectivity and ethical responsibilities. Limiting conversations to relevant treatment topics is essential for maintaining a professional relationship. Keep the relationship focused on the client's progress, not personal matters. Question 14. You are required to report to your supervisor regularly. What information is most important to share during these reports? A. Your personal feelings about the client and family. B. Any observed behavior changes, progress on goals, and challenges encountered. C. Details about your personal life or scheduling conflicts unrelated to the client. D. Opinions about the effectiveness of the overall treatment plan. Answer. B. Any observed behavior changes, progress on goals, and challenges encountered. This question is about what essential information you must communicate to your supervisor. Your supervisor relies on you to be their eyes and ears on the ground, providing objective information about how the client is doing, whether behaviors are increasing or decreasing, if skills are being mastered, and any difficulties you ran into, is crucial for the supervisor to monitor the case and make necessary adjustments to the plan. Personal feelings, unrelated personal information, or opinions about the plan, unless framed as observations or data points for discussion, are not appropriate for clinical reporting. Report the facts about the client's behavior and progress. Question 15. What should you do first if a client bites you and causes a skin break? A. Continue the session, but document the bite later. B. Apply first aid to yourself if needed and ensure the client is safe. Then contact your supervisor immediately. C. Implement the behavior plan step for biting. D. Ask the client why they bit you. Answer. B. Apply first aid to yourself if needed and ensure the client is safe. Then contact your supervisor immediately. This question tests your knowledge of safety procedures when you are injured. Your immediate priorities in this situation are your safety and the client's safety. Address any immediate medical needs for yourself, like cleaning the bite, while ensuring the client is secure and not in danger. Once immediate safety is handled, you must contact your supervisor immediately. They need to be informed of the incident, guide you on documentation, and determine next steps for the client and session. Implementing a behavior plan or discussing with the client come after ensuring safety and reporting the incident. Safety first, then report. Question 16. A client cries every time their therapist leaves the room. The crying behavior results in the therapist coming back into the room. If the function of crying is attention, what extinction procedure might the supervisor recommend? A. Give the client a toy when they cry. B. Pick the client up and hold them when they cry. C. Continue leaving the room as planned and do not re-enter immediately when the client cries. If safe, D. Tell the client stop crying when they cry. Answer. C. Continue leaving the room as planned and do not re-enter immediately when the client cries, if safe. This question asks how to apply extinction when the function is attention. The behavior, crying, is maintained by getting attention. Therapist coming back in. To put this on extinction, you must remove the reinforcement, the therapist returning. When the crying occurs, options are and/or provide tangible or physical attention, reinforcing the crying. Option provides verbal attention, also potentially reinforcing it. Option C describes withholding the attention, returning to the room, that maintains the behavior provided it is safe to do so, e.g., the client is not harming themselves. Extinction for attention means withholding the attention. Question 17. You are helping a client learn to request their favorite snack using a picture card. When they hand you the picture card, the behavior, you immediately give them the snack, the consequence/reinforcer. What type of verbal behavior are you teaching? A. Tact. B. Echoic. C. Mand. D. Intraverbal. Answer. C. Mand. This question is about teaching a specific type of verbal behavior. The key is that the client is engaging in a behavior, handing the cardie, because they want something, the snack, and the reinforcement they receive is getting that desired item. This is the definition of a mand or a request. Tact is labeling. Echoic is repeating. Intraverbal is conversational response, teaching someone to ask for what they are motivated for, and reinforcing it by giving them that item is teaching a mand. They perform the behavior because they want something. Question 18. You are collecting data using momentary time sampling on a client's sitting behavior. You set a timer for 1-minute intervals. At the exact moment the timer beeps, you look up and see if the client is sitting. If they are, you mark it. What are you recording? A. Whether the behavior occurred throughout the interval. B. Whether the behavior occurred at any point during the interval. C. Whether the behavior was occurring at the very end of the interval. D. How many times the behavior occurred during the interval. Answer. C. Whether the behavior was occurring at the very end of the interval. This question asks about a specific type of interval recording. The key phrase is at the exact moment the timer beeps, you look up and see if the client is sitting. This is precisely how momentary time sampling works. You only record if the behavior is happening at the brief, specific moment the interval ends. Whole interval requires the behavior throughout the interval. Partial interval requires the behavior at any point during the interval. Frequency counts every occurrence. Momentary time sampling gives you a snapshot of behavior occurrence at specific points in time. Question 19. When thinning a reinforcement schedule, you are A. Decreasing the amount of the reinforcer example, giving less candy. B. Making it easier to earn reinforcement example, reinforcing every response. C. Making it harder to earn reinforcement example, reinforcing less often. D. Changing the type of reinforcer used. Answer. C. Making it harder to earn reinforcement example, reinforcing less often. This question asks about a common strategy used once a skill is becoming independent. Thinning a reinforcement schedule means gradually requiring more responses or more time to pass between reinforcements, or moving from a continuous schedule, reinforcing every time, to an intermittent one, reinforcing only sometimes. The goal is to make the behavior more resistant to extinction and occur more naturally without needing constant rewards. You're essentially making the client work a little harder or wait a little longer for the payoff. Think of making the reinforcement schedule thinner or less dense. Question 20. A client is learning to identify objects when you say their name. You say touch ball, and they touch the ball. Then you say touch car, and they touch the car. This is primarily targeting. A. Manding. B. Echoics. C. Listener responding. D. Intravarbals. Answer. C. Listener responding. This question describes a common type of skill taught in ABA. The client is listening to an instruction, you saying the object's name, and then responding by performing a nonverbal action, touching the correct object. This is the definition of listener responding. Manding is requesting. Echoics are repeating sounds/words. Intravarbals are conversational exchanges. Listener responding is all about understanding spoken language and following instructions or identifying items based on what is said. Question 21. If a client starts exhibiting challenging behavior during a session, the first thing you should do, after ensuring safety, is typically to A. Immediately implement a timeout procedure. B. Try to guess the function of the behavior. C. Refer to the client's behavior intervention plan, BACB. D. Tell the client to stop the behavior. Answer. C. Refer to the client's behavior intervention plan, BACB. This question asks about your immediate action when a challenging behavior occurs and a plan exists. Your supervisor has already created a plan, Behavior Intervention Plan, or BIP, that tells you exactly how to respond to specific challenging behaviors for that client. After ensuring everyone's immediate safety, your primary responsibility is to follow the steps outlined in that BIP. You don't guess, implement procedures not in the plan, or just tell them to stop, which may or may not be part of the plan. The BIP is your guide for handling challenging behaviors consistently and effectively. Always check the plan. Question 22. You receive feedback from your supervisor that you need to improve your data collection accuracy. What is the most appropriate response? A. Feel discouraged and tell your supervisor you find data collection too hard. D. Politely disagree and explain that you are confident in your accuracy. C. Ask your supervisor for specific examples of where the data was inaccurate and request further training or clarification. D. Start collecting data differently without asking your supervisor for guidance. Answer. C. Ask your supervisor for specific examples of where the data was inaccurate and request further training or clarification. This question addresses how to handle constructive criticism professionally. Receiving feedback is an opportunity to learn and improve. A professional response involves seeking clarification, specific examples, acknowledging the feedback, and actively requesting support. Request further training or clarification. To improve your skills, disagreeing, B. Getting discouraged, A. Or making changes without guidance, D. Are unhelpful or unprofessional. Show your supervisor you are committed to doing the job right by asking how you can get better. Question 23. Before implementing a new skill acquisition program, you should always A. Practice the steps yourself. B. Read the program thoroughly and ask your supervisor any questions you have. C. Conduct a preference assessment. D. Ensure the client is highly motivated. Answer. B. Read the program thoroughly and ask your supervisor any questions you have. This question is about preparing to implement a new program. Before you work with the client on a new skill, you must fully understand exactly what the program requires: the EST, the target behavior, the prompting strategy, the reinforcement schedule, and the data collection method. Reading the program carefully and asking your supervisor for clarification on anything that is unclear is essential to implement it correctly and consistently. Practicing, A. Is helpful but comes after understanding the plan. Preference assessments, C. And ensuring motivation, D. Are important parts of preparing for sessions generally, but understanding the specific program details is the crucial step before starting that particular program. Make sure you understand the instructions before you start teaching. Question 24. When a client is learning a new skill, reinforcement should ideally be delivered on A. Fixed ratio, FR, schedule. B. Variable ratio, VR, schedule. C. Continuous reinforcement, CRF, schedule. D. Intermittent schedule. Answer. C. Continuous reinforcement, CRF, schedule. This question asks about the best reinforcement schedule for initial learning. When a client is first learning a brand new skill, it's best to reinforce every single correct response. This is called continuous reinforcement, CRF. Reinforcing every correct attempt helps the client quickly learn the connection between the behavior and the payoff. Once the behavior is learned, you can then move to intermittent schedules like FR or VR. To maintain the behavior and make it more durable, for brand new skills, reinforce every correct try. Question 25. Maintaining a client's privacy, storing records securely, and only discussing client information with authorized individuals are all components of A. Professionalism, B. Client dignity, C. Confidentiality, D. Ethical conduct. Answer. C. Confidentiality. This question asks for the specific term that covers protecting sensitive client information. The actions listed, maintaining a client's privacy, storing records securely, and only discussing client information with authorized individuals, are all practices related to keeping client information confidential. While these are certainly parts of professionalism, upholding client dignity and overall ethical conduct, confidentiality is the precise term used in ABA and healthcare to describe the responsibility to protect private information. Keeping client info private is a key ethical rule that's confidentiality.